afternoon, everybody. It is indeed my pleasure to be here to welcome all of you today for the special launch of Apollo Cellular and Bone Marrow Transplant Unit. In fact, it is a huge sense of pride, not just for Apollo hospitals, but also for Bangalore and Karnataka to have a unique facility closer to patients' home in South Bangalore, where newer advanced treatments such as cellular therapies and complicated or complex bone marrow transplants can be performed. Cellular therapies and bone marrow transplants are unique treatment options which are not available in every hospital, and Apollo Hospital is really fortunate to bring this facility closer to home, providing compassionate care to people, particularly based out of South Bangalore, and bringing more and more innovations as we go along, which Apollo is known and famous for.
First of all, I'd like to take this opportunity to thank you for coming and participating in this event along with all of us, helping us bringing this message out into the community and seeing how we can take this forward from whatever we've already been doing. So I think Apollo by itself has been doing excellent as far as oncology goes, and all my STP colleagues will come one after the other and probably talk about it. And today we are specifically gathered to talk about bone marrow transplants and cellular therapies that have been going on in Apollo, but this is a new phase. We are launching a new bone marrow transplant unit, and we are going to add to the excellence of care that Apollo is already offering. What exactly is this treatment modality we are talking about? So briefly to explain what is a bone marrow transplant. Bone marrow is nothing but the soft tissue that is present inside bones, and this is sort of considered like the factory where your cells are made. So your red cells, white blood cells, your platelets are all produced in this factory. And in severe life-threatening diseases like leukemia, it could be lymphoma, can be aplastic anemia. In genetic disorders, especially in children, can be thalassemia, again aplastic anemia, sickle cell anemia. They are all blood-related disorders where this bone marrow starts malfunctioning, basically not functioning normally. If you've heard of kidney transplant, liver transplant, so a normally functioning organ has to be given back to the patient, so the organ can start functioning normally again. Bone marrow transplant is similar but not the same as a solid organ transplant in many ways. So it involves replacing the diseased or defective bone marrow with healthy stem cells. It can be taken from the patient's own body in diseases like lymphoma or myeloma, or it has to be taken from a matched donor. We do what is called HLA typing and find a fully matched donor or an appropriately matched donor and perform this procedure. These stem cells then find their own way into the bone marrow and start the generation of a healthy blood and immune system. In simple terms, bone marrow transplant gives patients, especially children and young adults, a second chance at life. We almost consider it a rebirth because they are being brought back to the brink of death and given a new lease and a chance of life. Why is it that a dedicated BMT and a cellular therapy unit important? So in a multi-specialty hospital like Apollo, that has been around for almost 20 years now, we have been doing all sorts of very high-end procedures, including cardiac, liver, kidney, also some autologous transplants. But the goal is to offer what we call allogeneic transplants and CAR T-cell therapy or other cellular therapies that are now the newest technology that is coming to the forefront for treating oncology patients and patients with blood and cancer disorders. So we believe that a transplant unit cannot really exist in isolation. It needs the backbone of a multi-specialty hospital. Patients should be able to have access to advanced diagnostics, infection control, the appropriate critical care with the right intensivists being able to take care of these highly complicated patients. Radiological services, transfusion medicines, the right blood bank services are required, and a multidisciplinary medical supportive care all under one roof. Bone marrow transplantation is not a single procedure. It's not like taking the patient to the OT, replacing the deceased liver and giving a new liver. It is a complicated procedure, and it's a journey that requires the coordinated efforts of hematologists, oncologists, infectious disease specialists, critical care physicians, highly skilled and trained nurses, psychologists that help us counseling, and advanced laboratory systems. Having all these experts and services seamlessly integrated in what allows us to deliver safe, efficient and holistic care to every patient is what is going to make this Apollo cellular therapy and blood and marrow transplant unit significantly different.
Namaste, my name is Dr. Aditya Murli. I'm a senior consultant in medical and hemato-oncology at Apollo Hospitals, Bengaluru. ಇವತ್ತು ನಾವೆಲ್ಲ ಸೇರಿರೋದು ಫಾರ್ ದ ಲಾಂಚ್ ಆಫ್ Apollo Cellular and Transplantation Program, which is Apollo Cellular and Blood and Marrow Transplantation Unit. So this is a state-of-the-art facility which can provide the most advanced treatment for blood and blood related cancers in the form of CAR T cell therapy, bone marrow transplantation, be it autologous, allogenic and haploidentical transplants. We are also one of the few facilities in the country who are able to do across the board multidisciplinary treatment of these kind of diseases to make sure the outcomes are good. Thank you.
Dr. Vishwanath is Senior Consultant and Academic Advisor in the Department of Medical Oncology at Apollo Hospitals, Bangalore. And today is a very proud day for Apollo Hospitals, Bannerghatta Road, because we have launched this very novel and fantastic autologous, allogenic and cellular therapy unit in Apollo Bannerghatta Road. And it's one of those novel centers where we are able to do this comprehensive auto, allo and cellular therapies under one roof. And in fact, it's not done in many centers, especially talking about cellular therapy. It's done in very few centers. And in fact, compared to other centers in the US and the developed nations, we have significantly brought down the cost of doing the cellular therapies, and especially in relapsed high-grade B-cell lymphomas and childhood leukemias. And we are able to get at least 50 to 60% of cure rate with this novel therapy of CAR T cell therapy. Thank you.
I'm Dr. Poonam Maurya, Senior Consultant Medical Oncologist and Hemato-Oncologist at Apollo Hospitals. So today is a very, very big day because we have launched something called as the bone marrow transplant unit. And not only that, along with that, we have also launched the state-of-the-art cellular therapies. Now, cellular therapies is a big, big name because it includes everything. It is including the autologous, the allogenic stem cell transplant, and also the CAR T cell therapy. So this wide range of facilities being offered at Apollo brings these state-of-art facility towards our society, because there are many indications and very few hospitals have everything all in one at one place. So in this way, I'm sure Apollo is going to reach your home soon. Thank you so much.